Brisbane North PHN has developed a health snapshot of our region as part of a health needs assessment with our local hospital and health service. This assessment explores the health of our community and available services across 6 sub-regions: Brisbane Inner City, Brisbane West, Brisbane North, Pine Rivers, Redcliffe North Lakes and Moreton Bay North. There are almost 960,000 people living in the PHN region. The population is diverse, with more than 14,000 people of Aboriginal and Torres Strait Islander descent, and 20% of residents in the region were born overseas. We know that there are many factors that influence a person's health and the health of their community, including education levels, employment, income and housing stability. These factors are known as social determinants of health. While there are pockets of social disadvantage across the entire region, there are sub-regions that are more disadvantaged. For example, in Moreton Bay North, lower incomes, lower levels of education and employment lead to significantly higher rates of disadvantage, resulting in poorer health outcomes in that region. 1 in 5 adults in the region are classified as obese, and over 16% of adults currently smoke. Childhood immunisation rates in the region are improving, but they are still below the national target. These risk factors are all related to the social determinants of health. Residents in the PHN region enjoy longer life expectancy than the Queensland average. Nearly half of our adult residents live with a chronic condition. The prevalence of mental health issues is increasing, and deaths from suicide in the region are higher than the Australian average. The rates in Moreton Bay North and Redcliffe North Lakes are of considerable concern. Between 2015 and 2016, there were 280,000 emergency department presentations, and 40% occurred after hours. Over 1/3 of all emergency department presentations were considered potentially preventable. Between 2013 and 2014, 6% or nearly 24,000 hospitalisations in the region were potentially preventable. There have been recent improvements in health assessments and the welfare of Aboriginal and Torres Strait Islander people in the PHN region. However, our Aboriginal and Torres Strait Islander residents still experience poorer health outcomes compared to non-Indigenous residents. Poorer social determinants of health also contribute to this sizable gap. Within the region, there are over 300 general practices and 5 Aboriginal community-controlled health services. A range of community care services also operate in the region, which provide aged care, allied health, mental health, alcohol and drug, and other healthcare services. Healthcare services and the workforce in the PHN region are not distributed according to needs. Moreton Bay North has a particularly high demand for health services, but experiences workforce shortages. The information from the Health Needs Assessment, as well as consultation with key stakeholders and communities, helps the PHN to identify gaps and co-design solutions for primary healthcare services. To find out more, visit the Brisbane North PHN website.